Okay, guys, let's start the class because some people are complaining that we want the class to get started. That's amazing. That's the spirit, you know. You guys want to study. Amazing. That's the kind of students I like. So, today we're doing cases of surgery. So guys, today is going to be a marathon for you guys is because just announcing that after my class, the Eid class you guys missed, which was on 6th June. That class is going to be covered today after my class, but like after like an hour, a 1 hour break or something. Okay, so most likely like UK time would be 2:30 p.m. UK time. You're gonna have that class, okay? So um, let me just message in the group that we've started. Before people get angry, let's start again, okay? Let's quickly start the class, okay? Now, we're talking about surgery cases. We are basically going to cover now. Listen to me, guys. So, as you all know, that our basic structure, I've gone through it like a million times, which was RAPO, complaint, PMF, red flags, PMF TOSA, special questions, idea, concern, expectation. Then you go to the management part where you explain the diagnosis, investigate, treat, counsel, concerns, and safety net. Right? But I want you all to know that in surgery, structure changes a little bit. Okay, because I told you guys that's the one structure that I taught you that should be in all the cases. But some topics will render that you have to change the structure, okay? And mainly the structure where you need to change is in the ethical scenarios or the counseling cases. What I want to tell you guys is that surgery also comes in the ethical cases. Why does surgery come in this other book? So basically, surgery is not a part of history or consultations because in surgery there is some counseling involved where you have to tell the patient how to fast or do whatever before the surgery. I can't find my surgery board. There we are. So basically you have to tell them that, you know, fast and what happens after the surgery. Now, who is going to tell me what is that? What's the red flag or the safety netting in surgery cases? Where if you don't do them, you're screwed. Like you're not even screwed, it's like a medical error if you don't do it. In surgery cases.
Explaining the patient about the post-op complications
Brilliant. Well done.
and such.
Well done. Well done. That's it. So, NK, would you like to say anything? Okay. So basically, she's right. Well done. We basically tell them about the post-op complaint. That's so important. Please write that down in your notes because if you don't mention that you're supposed to tell them about the post-op, because that's honey, that's the main part. That's like if you don't do it, it's a medical error. Like then the patient can totally be like, I wasn't told of the complication, and then you're screwed. Like there's a whole lawsuit sitting on you. Okay, so be careful of that. That in surgery cases, your priority is telling them about complications. That's like your safety netting. Okay, and what can we do about red flags? Red flags, we can ask any systemic inquiry. Okay, so let's start with, there are two types of cases we'll discuss. One is surgery, and then we have scopes. Okay, so surgery is basically the proper procedure situation. How do we go about that? And then we have the scopes, procedures, which are the scopes. These also involve patient sleeping, and then you do the whole procedure. Okay, so there's different structure in both. Let's talk about surgeries first. Okay, so this is how the case will present. I hope everyone can see my screen. This is okay. Let me just show you how the case will present to you. You are in FY2, suppose you're standing outside the cubicle in PLAB 2 exam, and it's like, begin. The recording will play begin, and then you'll have 1 minute to read the prompt, and this is what you'll read. You're an FY2 working in the orthopedic. Oh, okay. Ted Lasso, 51-year-old, presented to the hospital for a pre-operative assessment. He's been arranged to have operation under general for the removal of a screw in the ankle. Got it. Okay, fine. So what's important over here? I need to remove the screw in his ankle. This is a day case procedure, okay? Which means you don't need to do much. You're not inserting the screw. If you were doing like the screw, inserting the screw thing, there's a fracture, that's a big thing. But just removal of screw, that's a very tiny operation. Okay, not really tiny, but like, yeah. Mr. Lasso's ankle fractured 1 year. He had a fixation done of his fracture with screws. Now he has come for pre-operative assessment to have ankle screws removed in 2 weeks' time. Got it? The consultant is so what? So guys, sometimes you know what will happen. Like you won't know. You will be like, okay, fine. Special note, and most likely you won't even get this prompt. What you must do. You'll just get the consultant has decided to do operation as a day case surgery. And now you're just like, so what am I supposed to do for this person? Like, I'm just sitting outside the cubicle, like, okay, should I ask his concerns? What do I have to diagnose something? What am I supposed to do? So these are like the FAQs that will come up in your mind. Okay. So what you're going to do, guys, whenever, write it down, whenever it's an operative cases, even if the prompt doesn't say it, you have to be thinking of pre-op fitness. Okay. So what you need to do, you need to assess his pre-operative fitness. So you go inside the cubicle. Let me see myself. I hope. So you go inside the cubicle, and what you do is, I'm so sorry. You go inside the cubicle, and what you do is you say, hello, I'm blah, 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 one of the junior doctor working in the orthopedic. Are you Mr. Ted Lasso? Yes, doctor. Okay, and I understand you're here for ankle removal surgery. You are scheduled for an ankle. Yes, doctor, yes. How do I go about it? After my rapport, I will tell the purpose, and then I will continue for my questions. Okay, so what did I tell you? Whenever the case changes a little bit, where you have to tell them the result. Now, number two, it's an operative procedure. It's any kind of procedure. What you need to change in your rapport, after the rapport, you have to state the purpose. And what is the purpose? So, Mr. Ted, I am here to ask you to have a chat with you to assess your fitness so that you can undergo the procedure. Do you guys get it? So this is how you're supposed to go about it. Okay, so this is the first step. This is what I want to teach you that, see, right now over here it says, please talk to the patient, assess his pre-op fitness for the daycare procedure and address his concerns. That's what it says here. But in some cases, it says nothing, and then you're confused. Look, she was admitted, she came for a pre-op assessment. Okay, you know what? Let's let it go. Sometimes it was the cystectomy procedure that I'm going to go through today. This one. She's planned to stay in the hospital after consent has been taken. Talk to the patient, address their concerns. So you're just like, what the heck am I supposed to do? In such a case, you should always go for, okay, I'm going to assess your fitness and I will address your concerns as well. Is that okay with you? Yes, doctor. Okay, and I will discuss how to do this procedure. So first things, I just wanted to clear that out for you. Okay, now let's begin the surgery. Let's begin the procedure. So guys, basically in surgery, how does our structure change? First, you go for rapport, but then you state the purpose. This is what I'm trying to tell you, okay? So thank you so much, Mr. Ted. I understand you're here scheduled for a procedure. Is that right? Could you tell me what the procedure is? Yes, doctor, it's my removal of my some ankle pin. So he has an idea of what it is. So this is also a way to ask him his idea, okay? All right. So, Mr. Ted, I am here to basically walk you through the procedure and also assess your fitness for the surgery. Will that be okay? Yes, doctor. Can I ask you some questions? Yes, doctor. So the next questions you're going to ask in cases of surgery is going to be head to toe, especially related to your case. For instance, it's an inguinal hernia case. In inguinal hernia case, what will you guys ask him? What is the head to toe to ask him?
We inquire about the hernia a little bit.
Okay, what will you ask? What were the questions?
Um, where exactly is it? Which side is it on? When did it start? Anything that makes it better? Anything that makes it worse?
Very good. So, could you tell me about what made you, come to the hospital in the first place? Doctor, I had a swelling. Okay, now you have a complaint. Good. So, could you tell me where is the swelling? Okay, and how long it's been going on? Very good, Arshi. Okay, what are the red flag questions to ask in this case?
All right, we ask for pain because it can get strangulated.
Very good. Brilliant.
And if there's a swelling, then we should always rule out cancer. So any fever, any lumps, bumps anywhere else, or any weight loss.
Very good. So our main purpose, Arshi, is very good, Arshi, is that the main purpose is to ask about the complications of hernia, which is, do you have any pain on that swelling? Do you have pain in your tummy? What are we going for? What are we thinking when we ask these complication questions?
Strangulation of the hernia.
Strangulation. What is another complication of a hernia?
Infection, so fever.
Okay. NK? NK, we can't hear you. You can chat. You can write in the chat if there's. What is the complication of a hernia? Yes, strangulation. What is that other one? That's a very common complication. It's intestinal obstruction. Intestinal obstruction. How do you rule out intestinal obstruction? What are the symptoms or signs? Symptoms. What did you ask the patient?
Any tummy pain, any nausea, vomiting,
Very good.
any constipation or
Yeah.
non-passage of flatus.
That's it. So did you notice any change in bowel habit? Did you notice any nausea, any vomiting? No. So these are signs. So intestinal obstruction and strangulation. Strangulation, beautiful complication. Well done. Okay, even if you ask just strangulation and then you ask even cancer, that's also fine. But I prefer you ask about intestinal obstruction after strangulation. Okay, because that's more directly related. For instance, patient comes to you with ovarian cyst. What are the complications of what will you ask related to head to toe in an ovarian cyst? I think you will ask about the cancer. You can ask about the cancer situation. You can ask her about the obstruction symptoms because the ovarian cyst can get so big, it can start obstructing the nearby structure. So you can ask her, have you noticed any constipation? Okay, and tummy pain, honey. Okay, and are your periods regular? Okay, that's enough. No need to go in too much. Listen very carefully to me, honey, because surgery cases, the management, the counseling part is quite long, right? So please keep your history short. Head to toe, be very quick. Okay, just 2 questions. Any pain you noticed on the swelling, and did you notice any vomiting or constipation? No, thank you so much for talking. Okay, and apart from that, in next you go to PMF TOSA. Very quick PMF TOSA. Could you tell me, and even in the PMF TOSA test, you should be more focusing on social history. Could you tell me if you have any long-term medical condition, any medicines you are on? What is the significance of asking about the medicines?
If the patient is is on any blood thinner, so that needs to be stopped before the surgery.
Well done. So basically, any medication, it's very important because medication, they are affected during surgery and sometimes in diabetic blood thinners, we change the medicine. Or either we tell them to stop. Okay. Well done, Arshi. And do you have any long-term medical, if he has blood pressure, if he has diabetes, that can change a lot of things. Good. Then you just go for social history. Could you tell me who you live with? I live with my wife. Okay. Will she be with you in the hospital? Is she able to come? Is she able to take you home? Yes, doctor. That's enough, honey. Please don't ask more than that. I'm going to show you the notes. I'm going to walk you through the notes and I'm going to show you that there's too much crap. I'm sorry. I don't want to say that word, but there's a lot of stuff, a lot of detail of questions. You don't have to go that far. Okay. Now you come to the surgery specific questions. These are, you have to remember this ugly guy. Okay. He's going to be your best friend. You're going to remember the teeth, neck, back, blood. Okay. Teeth, neck, you can see. So you have the teeth, you have the neck, you have the blood, and then you have the back. Do you have any loose teeth? or dentures? No, doctor. Any neck stiffness or back problems? No, doctor. And are you okay with receiving blood if required? Yes, doctor. So these are important. Why? Because you cannot do anesthesia will be affected in people who have neck and back problems, spinal problems. And then blood. Some people, Jehovah's Witness, are not okay with blood transfusion. So they will tell you on the, okay, but, and very important, ask about their ex. Okay, I'm so sorry. Um, uh, did you have any previous anesthesia, previous surgery in the past? Yes, doctor, I've had surgery. Were you given any anesthesia for it? Yes, doctor, they made me sleep. Did you have any complications to that anesthesia? Did you have any complications? So that we can anticipate this time that, you know, he might also again have a problem this time as well. I need to tell the anesthesia. Most likely he'll say no. Okay, so that's a good part. And then you can ask about, and now listen very carefully to me, very carefully. Blood transfusion question is more important in major surgeries. So in case of ankle pin removal, in a case of tiny like procedures that you know that are not that big of a deal, in those cases you don't need to ask for transfusion. But if it's a case of hip replacement, if it's a case of knee replacement, if it's a case of ovarian cystectomy, which is 8 by 8 centimeters, you should ask for blood transfusion. Okay, but remember, so teeth, neck, back, blood, and then their X. These are the surgery specific questions that you have to add on to your regular questions. Okay, so now you go for, that's it. So I tried to make the structure as short as possible because otherwise surgery goes very long, because there's a honey, you have to manage, and that management is too long. And then you have this honey, this whole like questioning. So I kept the questioning short. Let's keep it easy. Okay, so for instance, guys, let's practice it with you. A patient is about to undergo a cholecystectomy procedure for, because she had cholecystitis, okay, suppose a week ago. So what are you going to say head to toe? Let's start from head to toe. So what are the important history questions you'll ask?
Okay, why were you scheduled for the surgery in the first place? What symptoms were you experiencing? And then we take it from there.
Okay, Arshi, keep your mic open. Suppose she says, doctor, actually I had some fever and tummy pain, and then like they did my ultrasound and it showed there's stones. They said they'll remove my gallbladder. Now, what are you going to ask? Give me the entire structure. Keep this in mind. Go.
Okay, so could you tell me where exactly were you experiencing the tummy pain?
It was in my right side tummy.
Okay, and was it going anywhere?
No.
Perhaps to your back, your jaw? Or
No.
and you also mentioned a fever, right?
Yeah. Yeah.
Apart from this, were you experiencing any kind of nausea, vomiting, any
No.
problems with your bowels?
No.
Okay, did you also experience any kind of weight loss?
No.
Any lumps, bumps anywhere in your body?
No.
All right. And have you been explained anything about what surgery you are going to go for?
No, doctor, I want you to explain to me.
All right, I will explain everything to you, but I just need to ask you a few more questions. Do you have any long-term medical condition?
I have diabetes.
Okay. And are you on any regular medication for it?
No, doctor, I just control it with diet and exercise.
Okay. And are you regular with your follow-ups?
I am.
Okay. And would you say your sugar levels are under control?
They're amazing.
Okay, that's great. That's great. And apart from this, are you on any regular medications?
No.
Okay. And do you have any allergies at all?
No.
All right. And do you smoke?
No.
All right. And do you have any kind of neck or back problems?
Not at all.
Okay. And any loose teeth or dentures?
No.
Okay. And would you be open to getting blood, like getting blood transfusion if required during the surgery?
I think I'll be okay with it, yeah.
All right. And have you had any kind of surgeries in the past?
Yes, doctor, I did have some like C-section.
And I'm assuming you were giving anesthesia for that. Did you have any kind of problems?
No.
All right, that's great. And who do you live with?
My husband.
Okay, and will he be at the hospital when you're going to be undergoing the surgery? Will he be able to take you back home?
Yes, yes, doctor.
Okay, and I'm assuming he's going to be taking care of you at
Yes,
home after the
yes.
surgery? That's great. That's great. I think that's it for the.
Very good, Arshi. So you see, so guys, this is the perfect ideal history taking structure for surgery case. She has asked all the reasonable questions. Like what I want you guys to learn from this is please kindly don't take a really, what do you call it, detailed history of the presenting complaint. Okay, fine. She had tummy pain. Don't just go crazy. Okay, did you have don't take too long. Just like Arshi did, quick. Okay, and quickly go to the red flags, quickly do the other ruling out stuff. Okay, very good. And now you go to the PMF TOSA. You ask the important questions, you ask the special question, and that's about it. Literally in, I think, 2 minute, 30 second, her history is complete. This is something no one can do. This is a problem with surgery cases. No one can complete history that quick. It's not easy to complete history that quick. I will show you guys. We will go through the notes as well so that you guys understand what I'm saying. Okay, now what you're going to do. Okay, thank you so much for talking to me, John. Now I'd like to have a look at you. It will involve me taking your observation, including your heart rate, your breathing rate, and your blood pressure. And then I will have a head to toe look at you. Okay. And also, I would like to do your bedside test like ECG. If it's an old man, always do ECG. Your body to height ratio. What? Your weight to height ratio. And will that be okay with you? Yes, doctor. All right. Thank you so much. Now you come to the managing part. How do you manage a surgery part? Thank you so much for talking to me, John. Now, listen to me, guys. Organize. Okay, organize. What is your main aim over here? Your main aim is number one, tell him about his disease, tell him about the surgery, tell him about the procedure. Okay, wait. Tell him about number one. First, tell him about what's going on with him. Let me tell you, you have a condition called gallstones, and usually these have caused cholecystitis, which is an indication to cause surgery. So, obviously, explain it in simple words. I'm just telling you what you need to tell. Number one, their diagnosis. Explain to them their diagnosis first. Orientation. Give them orientation, what's going on. Number two, now, let me explain to you about the procedure. Go in sequence, the sequence that I'm about to teach you. You are not to go directly into the procedure. Go for before, during, and after. Then you ask concerns. Okay, so thank you so much, John, for talking to me. I would also like to order some routine testing. Now, John, I would like to tell you, after having a chat with you, it seems you are fit to undergo the procedure. Number one, tell him he's fit to undergo the procedure. That's the main purpose of doing this whole data gathering. Now, number two, tell him what he's having. John, as you said that you have a hernia, okay? Whether he knows or whether he does not know what a hernia is, you can totally go through it again, okay? Let me tell you what a hernia is. Exactly as you said, it is a type of loop of your bowel that gets out to a place where it should not be. Am I making sense? Yes, doctor. Okay. Therefore, the doctors have decided to do a hernioplasty surgery. Does that make sense? Yes. Let me tell you what a hernioplasty is. It's just a type of surgery which we will put back the loop in and we will cover that area up with a mesh so that it doesn't happen again. So this is a type of surgery. The reason we do the surgery is so that the hernia cannot cause further complications. Am I making sense so far? Yes. Okay, now let me walk you through some instructions. Will that be okay, John? Yes, doctor. See, keep it a conversation. What is the one breath rule? Honey, you don't speak more than one breath. Because the more you speak, the more you will stumble upon your words, the more you will mess up. Write this down, okay? So, honey, don't call him honey, you're screwed, okay? If you do that. So, John, this is also why my number one IPS hack is one breath rule. Don't speak more than one breath. Number two, keep saying his name. Keep saying his name. His name will orient you. It will keep orienting you. Plus, you won't even know, but like every time you say someone's name, it's a psychological effect. There's this closeness you feel with that person, and that person feels with you. Okay, that's more important. Now, what you do is, now I will give you some instruction. Will that be okay? Yes, doctor. Okay. First things first, if you forgot to mention routine investigation, I will send some investigations, some routine investigations. You don't need to mention too much about what investigation, okay? Now, let me tell you, on the day of the surgery, we will have you first fast. So these are the pre-op, during op, post-op rules. Just memorize the ones that I'm teaching you. Don't go extra unless required. So pre-op, we will ask you to fast for 6 hours. So you will stop taking any kind of solid food 6 hours before. 2 hours before, you have to stop any liquids. Does that make sense? Okay, doctor. All right. Now let's talk about what happens in the operation. We put you to sleep in general anesthesia. Okay. And while you're asleep, we will make an incision around your bikini line or whatever it is. Okay. You will read about all the various procedures and you'll learn them, and you won't know. It's not really rocket science. Okay. It's not like a rocket science memorization. It's like very easy. You just have to remember which incision is for everything. For instance, bikini line is for the ovarian. Fannin steel incision is for, I don't know, you'll figure it out. And then we will give you a minor incision. And then we will open your tummy up. Or maybe it's a laparoscopy. We will make a tiny incision and then we will fill gas. And your tummy will swell up, so we're able to visualize. Then we'll pass the camera inside. And once we visualize where the hernia is, we will take that, we will put it back to where it came from. Then we will stitch up that area so that it doesn't leak out again, It doesn't move back to the starting point. And then once we stitch it up, you can say that we will use absorbable sutures, so you won't really need to have to get them removed. And once that's done, you go to the post-op part. You will be shifted to the recovery room. All right. You will be shifted to the recovery room, and then slowly you will come back. The anesthesia will wear out, and that's about it. Most importantly, John, I need to tell you that there are some complications that you should know beforehand. Obviously, there are less chances for this happening. We have a very expert team, but it's necessary for us to let the patient know about these, okay? There might be some pain after the procedure. Sometimes bleeding may occur. Sometimes infection can also occur after operations. So these are the main guys: pain, infection, and bleeding. These are something you have to tell to the patient. If you can't recall anything else, at least say the infection, bleeding, pain. Because infections, a lot of patients will come with infections. Now my brain's going to get awake. So once you're done with that, now any questions, Mr. John, up to now? No, doctor, you've cleared it up so much for me. That's something that will happen in your dreams. Obviously, that patient is not going to be that happy. Patient will be like, doctor, when can I go back to driving? When can I have intercourse? When can I go back to work? So this is a general rule. If you can't recall the durations, that's fine, honey. That's fine. You have to take guesses. It's not necessary for you guys to memorize everything, okay? It's okay. If you don't know like how many weeks, take a guess. Like my guesses are 4-1-8 rule. And depending on the majorness of the procedure, how major. If it's a major procedure, for instance, like a, hip replacement, then you have to be like, bro, you have to be on bed rest for at least 2 months. Okay, you can go back to work after 8 weeks or 2 months. You can exercise after a whole month, or you can drive after a whole month. For intercourse, you can do it after 1 week. Usually, as I told you guys, like this exam is, it's fixed. So the questions they will ask you, these are the durations that you have to memorize. So whenever they'll ask you about this intercourse thing, it's most likely going to be after a minor procedure. So that's why it's always 1 week. You guys get me? Okay. So just remember the 4-1-8 rule. 4-1-8 rule. So drive, exercise 4 weeks, work 8 weeks. Even if you mess these durations up, honey, they won't fail you, because this is not the priority of the exam. The priority is that this candidate will learn the durations. But is this candidate safe or not? That's how we come down. At the end of the day, that's all that matters. That's what I'm trying to. I've been brainwashing you for the past 2 weeks, if you guys noticed. I've been brainwashing you to tell you guys the real priority of this exam is always going back to the safety. And once you're able to know the priority, you will nail that exam. It will be piece of cake for you, because you know the priority. That's the problem. Everybody goes into knowledge. They just want to show off their knowledge. That's not the exam. Okay, now you explained the complex. Any questions up to now? Quickly address his concerns. You'll be like this, that, this, that, this, that. Honey, listen to me. This. Okay, thank you so much, doctor. All right, at any time, just remember from the wound, if you feel like there's pain in that wound, if there's a fever you're developing, always remember these are important signs. You have to come to the hospital immediately. So these are surgery cases. So let me tell you what type of different types of concerns patients come with. Number one, this ankle pin guy, he will have an issue. Doctor actually had a procedure done, external fixation of my ankle last time. And doctor, I vomited the whole time during the anesthesia. Oh, I'm very sorry to hear about that, John. So this will be his concern. So when you ask him his concern, mostly people will have these concerns. And I will tell you how to address each and every concern. You just have to memorize because always these concerns are going to come. Okay, you didn't hear it from me. So firstly, for vomiting, John, what we're going to do is, I'm very sorry. That must have been so distressing for you. So John, don't worry. Just because you had it last time doesn't mean you'll have it even this time. Don't worry about it. We will even give you anti-sickness medication. And if required, after the surgery, we'll keep you for a day if your vomiting doesn't settle, if there is an issue with vomiting. But hopefully, it won't happen this time. Okay? We'll be taking care of you, extra care of you. And then wink at him. Don't do it. I'm kidding. Don't wink at him. Okay? He's gonna be like, what the heck? Doctor-patient relationship, where is that? Okay? So next is pain. Doctor, but it hurt the last time. Or doctor, I'm so scared of the pain. Doctor, this. Oh, I'm very sorry. I know where you're coming from. Keep always acknowledge my loves. Okay. Don't forget my IPS hacks. Number one is talk in one breath. Number two is acknowledge every damn thing. Number three is I forgot. Number four is take his name. Every time take his name. Every time take his name. Number five is ethics should have short 2-minute history. We're going to brainstorm over all of the rules that I taught you in this course soon. Okay, pain. Always tell them, I'm so sorry. I'm so sorry you feel that way. I know how distressing it is. I know this is daunting. But see, this time I will write specially to the doctor. I will tell him, have a chat with him to make sure that you are given very good painkillers. Are you following me? That your pain is addressed. Anytime you have pain, we will be there for you. Okay, now comes the truss question. Now, the truss is a type of a belt that people with hernia are given. He'll say, doctor, why are you doing why are you doing hernia surgery for me? NK, when I said write in chat, I meant in the Zoom chat, not, not in the WhatsApp group chat. But that's nice. You said obstruction, well done. Why can't we hear you though, NK? So, yeah, NK, I really can't hear you. So what you can do is like, write in the Zoom chat, say what you have to say if you want to answer any question. Okay, truss. So what is truss? Basically, he'll be like, doctor, why are you doing a surgery for me? When my dad, he also had the same hernia, but they just gave him this truss to wear. So let me show you what a truss is. You guys should know everything as doctors, like what is a truss? It shouldn't just be like truss, okay, it's a belt. No, see it. So you know everything. Okay, I don't want to take a picture of this. I'll just show it to you guys. Guys, this is what a truss is, okay? So it's like a belt they wear. Anyway, so what he's gonna be like, doctor, why don't you just give me a belt to wear? Why do I have to like go through surgery? So this is the answer to that question. Remember that the trust situation is that I forgot. The trust situation is that you have to tell him that usually we give the trust to patients that are not fit to undergo surgery. And secondly, trust now, after research, it has shown to have limited or no benefit at all. So it is kind of like we don't use it anymore now. Are you following me, John? This is what you're going to do. Okay, guys? So that's the trust rule. Trust rule goes like, most likely your father was not fit. That's why maybe they gave the trust. Usually we give the trust to people that are not fit for surgery. But trust has limited benefit. Then comes concern of having children. Now the lady, she will have an ovarian cystectomy removal. Her main concern will be, doctor, but will I be able to have children after the surgery? Okay, remember, very important concern. If you're able to address this concern well, she's a very good patient. Like I've had this case in my exam. She's a very good patient. Like the simulator is a happy simulator. But only if you satisfy her, she is happy. She'll be like, thank you so much, doctor. Okay, feels so much better. She's a very happy simulator or whatever. I hope they use the same simulator. I imagine like some new person, like some rude person. No, but like I think the simulator are told to be happy. So anyway, so the children's situation, she'd be like, doctor, will I be able to? All you have to tell her, oh, I completely understand where you're coming from, Samantha. But I want you to know, my love. Don't ever do that. Okay, I'm just kidding. So I want you to know that, oh, I completely understand where you're coming from. But I want you to know there is nothing to worry about. Okay, I'll tell you why. Firstly, we're aiming to remove the cyst only. We are trying not to remove the ovary with it. Okay, that's what we're going to try. Even if we have to remove the ovary, if required, then I want you to know your other ovary is well and working, and you can definitely have children in the future. So guys, this is one thing I want to teach you. Please address her concerns like perfectly, meaning answer her question. Like word to word answer. Her question is, can I have children or not? So your ending line should be, so yes, you can definitely have children in the future. So you know what people do? They'll just be like, see, we will try to save the other, we will save the other ovary. And she'll be like, okay, what does that mean? So, honey, answer her question. So, yes, you will be able to have children. Okay. So, that's also like an IPS hack or whatever you can call it. Then, one of the patient might be like, doctor, may I don't want to, can I do spinal? I don't want to do general. I don't want to fall asleep. Oh, always ask why. Oh, is there any particular reason why you don't want to undergo the general anesthesia? Doctor, actually, I don't know, I'm scared or whatever it is. I want you to know we have an expert team. There is nothing going to go wrong with you because they do it every day. It's like, they're very expert and blah, blah, blah. They're proficient in what they do. He'll be like, doctor, actually, whatever. If he still persists, what you need to do is, all right, I understand where you're coming from. I'm going to have a chat with the senior, with the surgeon, and we can see what we can do about it. Does that make sense to you? Will that be okay with you? Yes, doctor. Okay. So spinal anesthesia is something that you as a junior doctor cannot decide. This is a decision of the anesthetist. So you can just tell them, okay, I'll have a chat with the anesthetist and they can decide if you would like. Only if he persists. Otherwise, try to convince him. As you've gotten the prompt that he needs to undergo general anesthesia surgery, you have to follow that. As a junior doctor, you've been given the command by the senior doctors. You can't just make up your own stuff. So if the senior doctor has written general anesthesia, you can't question it. You can't say, I will convert it into spine. Who are you to convert it? Okay? You know what I'm saying? So don't do it without a senior or whatever talking, having a chat with the anesthetist. Then, doctor, can you give me antibiotics after the procedure? This antibiotic concern is very interesting. Always remember, there are two indications for antibiotics after procedures. Would anybody like to attempt? I think Arshi knows this.
So the two indications are A, major surgeries, and B is immunocompromised states like diabetes,
Well done.
is on steroids.
So exactly. So there are two conditions where you even give antibiotics after surgery. In UK, we're not talking about our countries, right? In our countries, it's always antibiotics. Give antibiotic number one if it's a major procedure, huge. You're opening up the tummy. You're dealing with fluids. You're dealing with gallbladder. It's gonna be pus everywhere. Okay, no, you need to do antibiotic in that case. Number two, if everything else is fine, she's an old lady. She's 50-year-old with long-term diabetes. long-term medical condition, older patients, all of these are indications. Okay, so most likely this patient will be a 30-year-old who underwent a cystectomy of her leg, and she's like, why didn't I get antibiotics? And we've already discussed this scenario in angry patient. So surgery, one of the surgery scenarios is angry patient. This one right here. This is a surgery case. Okay, so you're in FY2, Elizabeth Smith, 30-year-old, readmitted. With post-op, she has a cyst removal 3 weeks ago. She's discharged home. She was admitted with now wound infection. She's been treated with antibiotic. Her concern will be, why didn't you give me antibiotics in the first place? Who do you think you are? Who the hell are you? Okay, she'll be angry. You have to fix her. Okay, and we've already discussed how to do that. But majorly in surgery, you should know how to address that concern. The concern I've already told you. Now let's talk about different scenarios that will present in surgery. Always assess medicines, date of birth medicines. Even if she says I'm not on any medication, say the DOBs, any diabetic, okay, diabetes, forget that. Any contraceptives, any blood thinners. Make sure to ask about these proper, like say the words. Don't just be like, are you on any medication? No. Then ask it. Any blood thinners, any contraceptives, because sometimes they don't consider contraceptive medication, or they might forget to tell you about the contraceptive. Okay, date of birth medications. Now, what is the blood pressure rule? The blood pressure rule is that if the BP is 170/100, cancel the surgery. Keep these in mind, keep writing them down, keep memorizing them. Right now, we're going to step into the notes and I'm going to ask you these questions. Remember the ground rules. The only thing you need to memorize is in this sheet right here, and the structure, of course. Now, if the BP is high, for instance, it's 160/80, tell him that stay a day in the hospital, involve a heart and a specialist anesthetist to control before the surgery. That's it. So, okay, since your blood pressure is high, we're going to request that you stay in the hospital for a day before your surgery and after your surgery. At the same time, before the surgery, we will involve a heart specialist and an anesthetist so they can also have a review of you. Okay? And make sure your blood pressure is under control during the surgery. Okay? And once you're done with the surgery, we will recommend that you go visit your GP and get your BP control back. These are usually for patients that is incidental finding of high blood pressure because they're undergoing surgery. So randomly we measure their blood pressure and it shows it's high. So what do you do for those people? You just tell them, okay, we're going to discuss this when we go into the notes. Now, address the concerns. You should know how to address the concerns. I've taught you guys all these concerns that are going to present in surgery cases. Hernia and ankle pin removal. These two are both day cases. So you'll be like, so which ones are day cases? Which ones are not? Hernia is a day case, girl. And ankle pin is a day case procedure. Don't forget. So day case means that it's just you'll do it in the day and most likely you'll be discharged in no time. So you just need someone to come and get you. That's it. It's like a simple procedure. Not exactly simple, but yeah. Luckily, we've discussed this. We've discussed the knee replacement criteria. We've done the knee replacement scenario. When did we do knee replacement? We did it in the previous class, counseling. So if there's severe pain, if the severe pain is impacting her day-to-day activities, if the pain is in the night, and if her BMI is less than, this is an indication to go for a knee replacement surgery. We've already discussed this. I don't think we need to do more. Coming to hip replacement surgeries, the most important, same way you go about the pre-op fitness, you go about the investigations, and you go about everything. You tell her what the procedure is. But in this, the complications are important. And the second thing that's important is the hip replacement advice. Hip replacement advice, if not given, there are chances your marks will go down. This is a safety netting advice. This is so important, super important. So once your surgery is complete, there's some instructions I want you to follow. Okay? Okay, doctor, what should I follow? Do not bend your hip more than 90 degrees. For instance, picking up things. Don't do that for a couple of months after the surgery. Are you following me? Yes, doctor. One more thing, try not to sit on low chairs, okay? Don't cross your legs. And even if you want to turn around, take very small steps. We need to give this hip replacement advice. Why, honey? Why? The reason we need to give hip replacement advice because there is n amount of surgeries that fail because they bent more than 90 degrees. Nobody told them. They bent more. Their hip replacement failed. The thing slipped out. The, what do you call it? The new hip, that fake hip, it's got dislocated. Very common complaint. So whenever someone's going through hip replacement, please give them very good, like long, detailed discussion that, honey, don't overexert. You have to be careful after the hip replacement because it takes some time for the hip to get fixed in your body. So please don't bend to pick up things. Do not sit on low chairs. Do not press your legs. And even if you want to turn around, take very, very, very small steps to turn around. You have to be very careful. If you are able to mention this, the examiner will literally, he will forget the mark. He will stand up and he will clap for you like that. So remember these. These are things that not everyone, now this is where I'm going to tell you, this is how, where majority people that are giving third attempt, fourth attempt, 15th attempt of exams. I've seen it from my eyes, third attempt people. I've seen the biggest mistake. The way they talk is very good. The IPS is so good, then why are they failing? The main problem is that they are so concerned about delivering all of this information, asking so many questions that they won't even say this main thing, that they won't even say about the complications. This is the biggest mistake in PLAB 2. And I've been brainwashing you for the past, I don't know, how long was this course again? For like a month. I was brainwashing so you don't make this mistake. So your exam is passed in the first attempt. If you took my lectures, your first attempt, huge chances you're going to pass it in first attempt because you understood the priority. Many people that are coming to me with second attempt, help us, help us. And when I talk to them, I realized they didn't even know the priorities of the exam. And now they're like, shoot, why didn't anyone tell me this before? They're like, thank God you told me this. Why didn't I know this before? This is literally them. They didn't know the priorities of the exam. Okay. Now, whenever it's an elderly person, listen very carefully to me. Whenever it's an elderly person going through surgery, 60-year-old with a hip replacement, 60-year-old knee replacement surgery. Okay, I have this advice to give you. You're going to say this advice. And one more thing, I'm going to also have occupational health team visit your home. The team is going to come to your home and they are going to make your home well adjusted to your condition. So guys, in NHS, there's another service, which is the occupational health. It's the team that goes to like the house or the homes of people to adjust their home according to their condition, free of cost, covered by NHS. What a service is that? There's something we don't have enough. So for instance, you have a patient who's CP child. We'll be like, okay, occupational health will go to your house and he will adjust. Especially forget CP child. Most likely CP child doesn't come in PLAB 2. We're just giving you an example. Most likely you will have elderly who has hip replacement, who has anything related to falling down, just fragility, osteoporosis. Okay, you'll be like, we will have occupational health team. Doctor, what will occupational health team do? They will come to your house. They will see. So what does occupational health team, what can it do? Like, for example, like we know it'll come to the house, make it well. How does it adjust? How does it make the house well adjusted to the patient's condition? That's the question that comes up. So what they do is they will look for any loose carpeting. They will fix that. They will install higher chairs for you so that you don't have to bend. Number two, they will give you they will install railings so that whenever you're walking, there's something to always hold on to, support or grab onto. And then they will fix your lighting if there's dim lighting, because sometimes elderly don't have good eyesight, so they fall because the lighting is dim at their place. You don't have to explain all of these things. The things that I'm telling you is for your concept, that if you get in a job in the NHS, you should be able to know these things. Like, what is the occupational health going to do? You should know these things, because obviously it's not just like for an exam. You're actually studying for long term. Now, this is it. Okay, so these are all the surgery. Let's go through one or two of the surgery scenarios by like notes so that you know how to read notes. Okay, why is there a truss over here? Okay, let me show you guys. So FY2 working in surgery department, Andrew Portland, 43-year-old diagnosed with inguinal hernia, came for pre-op assessment. His BP is 160/90. Who's gonna tell me what's the criteria? What are we supposed to do about 160/90?
We are still gonna go through with the surgery, but we're gonna admit the patient a day before the surgery and have the anesthetist and a cardiologist review him and control the blood pressure before the surgery. And after the surgery, we're gonna keep him on regular follow-ups and monitor his blood pressure.
And that's all I want, guys. That's all I want. If you can memorize with me during the class only 3 points, honey, go try to study it yourself. Life is going to be easy. Well done, Archie. So consultant will come back later. He'll take the consent for the surgeon. Nobody cares about the consultant. Just talk to him. Okay, just talk to Mr. Portland. Now you have to be like, okay, Archie, go ahead, do the rapo part. Or does anybody want to do rapo? Archie, go ahead.
Hello,
Hi.
I'm Dr. Vaseem and I'm one of the junior doctors at the department today. Are you Mr. Andrew Portland?
Yes, doctor, that's me.
And could you confirm your age for me, please?
I'm 43.
And how would you like me to address you?
You can call me Mr. Portland.
All right, Mr. Portland. So I understand you're planned for a surgery, is that correct?
Yes, doctor.
Well, I'm here to explain to you about the surgery, like what to expect, and just to assess your fitness for the surgery. So is it
Well
okay
done.
if I ask you a few questions?
Well done. So this is what I wanted to show. She stated the purpose. That was so good. So Archie has understood whenever I do the rapo for surgery cases, I need to do the purpose after it, and then I go about the normal structure. Well done, Archie. Okay, so let's see what the patient, the simulator will get. Andrew, I'm Andrew. Suppose I'm the simulator in the exam and I'm reading this. I'm a 40-year-old, okay, I have inguinal hernia and I am scheduled for a hernia operation in 2 to 3 weeks. Got it. I work for myself. You have a warehouse, your work requires heavy lifting. You do not know how the hernia is being done. Huh? Okay, you have been smoking, smoke 20 cigarettes a day. The nurse has told you BP is high. Your father had hernia repair, he wears a truss. Okay, and his concerns have to be, see, the simulator gets concerns. The concerns are fixed. Why can't I wear the same thing as my father? When will I be able to drive? I've told you all of these things. When will I be able to go home after this? How will I okay, what exactly are they going to do in the operation? We all know. Will the surgery be cancelled because of the high BP? So all of these things you already know. How, when I will be able to go home after the surgery? It's a day case procedure, my love. You can go home on the same day, maybe in the night. So if you guys go through the notes, this is how you're going to read the notes. Hello, I'm Dr. One of the junior doctors. Can you confirm your full name? I understand you've been scheduled for, okay. I have asked to come in, and if you have concerns and blah, 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 I have explained the blah, blah, blah. Okay. Now assess patient note. Do you know what a hernia is? Yes, doctor, it is. No, I don't know what it is. So it's basically a swelling that occurs. You can say your own words. Try not to copy these words. Okay. Are you following me? Yes. Okay. It happens when a pressure is increased, coughing. This is too much work. Too much work. Okay. You can, yeah. Okay, you get what I'm saying? There's no, like, yeah. Try to keep it simple. He will mostly, if he understands, don't do the pen paper. Okay, I can see from the notes, one of the nurses have examined you, blah, blah, blah. Have they taken any? These are too extra. Go for this. Can you tell me how long, a few months, when did you notice it? Which side is it on? Okay. How was the size recently? Okay. And do you have any cough, sneezing, constipation? No. Do you have any pain? And can you not push it back? Do you have constipation, obstruction? Done. That's him out. Like, khatam, finish. Have you had any similar problem in the past? Have you been diagnosed with medical condition? Okay. And are you on any medication? That's enough. Okay. And may I know what you do for a living? So in guys in hernia, add on the occupation history. May I know what I work in a way? Does this involve involve having does it involve lifting heavy weights? Yes. Who do you live with? I live with my wife. Okay, that's about it. Do you have access to a phone? Oh my God. This is what I'm saying. You don't need to ask every question. Don't need to follow notes word to word. Just ask the important questions. No need to say first 48 hours. Can she stay with you in the hospital? That's enough, honey. Were you ever put to sleep? Exes, lose tooth, dentures, neck problems. Okay. And smoking, if you don't ask smoking, nobody's going to kill you, my love. Nobody's going to kill you. I'd like to have a look at you. Okay. So first things first, let me explain to you. This is a hernia. A hernia is this, and we're going to do a procedure for it. Okay. Are you following me? Do you have any questions up to now? Doctor, they said my blood pressure is high. If he doesn't say it, you have to address it before. Okay, yes, we did check it's on the higher side. This doesn't. So look at the paragraph. Like, it's huge, but we've simplified it. This doesn't necessarily mean you're diagnosed with. You can go to your GP. Too much work. Don't say that. We have to involve a heart specialist and instead to have a say in the blood pressure. You need to be controlled before surgery. This is too much work, girl. Don't do too much work. Just say the 3 points that I told you. Whenever something's like a huge paragraph, compress it to bullet points. Number 1. Yes, your blood pressure is high, but it's not high enough to cancel your surgery. Number 2, what we're going to do is have a heart specialist anesthetist come for you, and you will have to stay a day before because of you have to stay in the hospital. Okay. All right. Now, let me explain to you the whole surgery procedure. Okay. So first, you need to stay in fasting before. Then the surgery will be, no need to say, it could be open surgery or a keyhole operation. Just choose one, girl. Just choose one. Andrew Portland pre, okay, nobody mentioned over here what type of surgery it is. Fine. Just say keyhole surgery. Okay. It's going to be a keyhole. And, it's usually takes 30 minutes. 3 small incisions are given. And through them, a laparoscope, which is a camera, will be passed. That's about it. Then your tummy will be filled with gas. And then we can fix the hernia. So guys, there's a lot of stuff written over here. Make up your own words. Make up your own words. Make up your own words. Please make them not more than 2 lines for surgery. Keep it simple. Patient does not care. We go to a car mechanic and we're like, how are you going to fix my engine? And he'll be like, we will open up the box. Then we will insert tube into the, I don't want to know. Just tell me the basic. We're going to take the engine, put a screw inside and close it. So this is how normally people want to hear. Now, what is the advice you need to give him? Now, see, you told me that your job, you involve working with heavy weights. I advise that you don't go back to your job for at least 2 to 3 months after the procedure, because see, as much as you lift heavy weights, it's chances for hernia to reappear. Are you following me? Yes, doctor. Any concern, doctor? Why don't you give me a truss? And I already told you guys, truss is a temporary solution for who are not fit for surgery. And this is too much work. Just say it's for not fit for surgery. Truss is also generally no longer recommended. It has a limited benefit. Doctor will, yes, some pain will happen, but don't worry. We will give you some local anesthetics, anesthesia, blah, blah, blah. Okay, when can I have sex? You can do 2 to 4 weeks. And as soon as you are comfortable to perform sex, you can even do that. When can I work 4 to 6 or 8 weeks? 8 weeks is better, I believe. That if you can say a maximum number, it's better than saying a minimum number. You will always be safe. And please try to avoid lifting heavy weights. Simple. Doctor, are you going to cancel my surgery because of high blood pressure? No, honey. We only cancel if it's above 170 by 100. That's about it. These are all extra things. If you have any time, you have loss of appetite or pain at the surgical site, come to the hospital immediately. See, for the hip replacement surgery, ovarian cystectomy, same thing. I can see your schedule for a surgery, blah, blah, blah. And then you go for, thank you for answering my questions. You have a dermoid cyst in your left ovary. Now, I want you to know this type of cyst that contains hair, bone, and teeth. So this is too much. You have to shorten this. Okay, notes will tell you 10, 20 things. You have to keep it time friendly. You have a dermoid cyst in your left ovary, and this cyst consists of hair, bone, teeth, fatty tissue. Okay, but I want you to know that this is completely benign. There's nothing. The problem is that it is 8 centimeter by 8 centimeter, which is quite big. That's why we have to remove it by surgery. Don't worry. I did not make this up. I did not make the 8 by 8 rule. They told us in the prompt that cyst is quite large. And her only concern will be, as you can see guys over here, same thing. Post-op care, worried about painkiller, worried about this, worried about infection. If she won't be. Her main question will be, can I have kids? Great. There's no can I have kids in this. Why? Or is there? Anyway, even if she does say the kids situation, always tell her that it's okay. Kids are not a problem. I already told you guys how to address that. Now we go to a very tricky case. Very tricky case. It's a little different than the normal case. Let's see what you guys say. You are an FI2 working in the GP. Adam Green is 28-year-old man. Now just see, guys, this is how normally in other academies, this is what they do. They read notes. Literally just what I did. Wasn't it the most boring thing in the world? And they'll just keep reading the notes, reading the notes, reading the notes. They don't tell you any structure, nothing. They just read the notes for you. This is what they do in all other academies. That's what I'm trying to tell you. Like, just watch how you were like, oh yeah. And imagine they do that for like 12 hours. Adam Green, 28-year-old, decide to have a vasectomy as a means of contraception. Please talk to Mr. Green. Explain the procedure, address his concerns. Guys, this is a very tricky question. What in this case, 28-year-old man coming to have a vasectomy. What are you going to do in this case? What is the purpose? What purpose will you give him? That this is what I'm going to do for you today. Tricky, right? You can try. You can just give a guess. I'm
Sorry,
not here
to
to
ask now, what was your question?
like, this is the case. 28-year-old man wants to do vasectomy as a means of contraception. What questions are you going to ask him in this case? Like, what is the purpose of consultation today?
Okay, why do you want to get the vasectomy done in the first place? First, check his understanding if he knows what vasectomy is, if he knows it's permanent, and why he wants to get it done in the first place, and if he's explored other methods of contraception or not.
Okay. Arshi, will you assess his fitness for the procedure?
I mean, I don't know, I'm confused.
No, you brilliantly spoke right now. I don't want to like reveal that you did brilliantly because I first want you to tell me yes or no. Do you need to assess his fitness, yes or no?
I mean, he's not scheduled for the surgery yet. He wants to undergo it, right?
So you don't want to assess. Say yes or no.
I mean, if they fail me, I mean, to be in the exam to be on the safe side, I will assess. I'm sorry. But I
Okay,
don't think
okay.
he's too young.
Good. So exactly, Arshi's mentality is perfectly fine. She will stay on the safe side to assess. However, will you go ahead with the procedure? Will you do the procedure? No. Honey, big no. Hell no. Okay? You are to exactly what I said. First, assess. Does he even know what a vasectomy is? Yes, doctor, it's a way of contraception. All right. Do you know that it's a permanent procedure? I guess it is. Okay, doctor. All right. Did you explore other means of contraception? Doctor, are there other means of contraception? So this is the problem. He's so young. He thinks the only way to get contracepted is this. So vasectomy case. This is the structure you're going to follow. Assess his knowledge. Okay, do you know, John, what is vasectomy? Doctor, I know that you just like cut off the thing and whatever he says, like you won't, like, all right. And do you know that it's a permanent procedure or not? Yes, doctor. No, doctor, actually, I thought it could be reversed. Okay. And can you tell me the very important, in this entire case, your history should be focused on assessing his knowledge about vasectomy. Second thing is his sexual history and his partner and his family, meaning, do you have children at the moment? Doctor, I do not have any children and I do not want to have children. Okay, fine. And explain him the seriousness. This is the whole vasectomy case. Assess knowledge, sexual history, partner history, family history, and then explain the seriousness. What is the seriousness? I want you to know that it's a permanent method. You are young. Now listen, it's a 28-year-old saying, doctor, I will never want kids in the future. What I want you guys to remember is consider a 28-year-old and a very immature man. I don't know why this is what the NHS has basically in this case signified. If you read it, it seems like NHS thinks that 28-year-olds are stupid. So let's keep it like that. Always remember, if a young man comes to you, 28-year-old, saying, I don't want kids in the future, you have to tell them to rethink. Okay? You have to tell them it maybe at the moment you don't want them, maybe in the future you might want them. So, how about go for a more reversible or temporary method of contraception? Now, let me do this case for you. Okay, so you understand better. So the case goes like FY2 working in the GP, Adam Green, 28-year-old, decided to have vasectomy as a means of constipation, contraception. Talk to him. All right. Hello, I'm Dr. One of the junior doctors in the GP surgery. Are you Mr. Adam Green? Yes. So what's your age? Okay, 28. And what would you like me to do? Adam. Okay. From now on, let me tell you how you're going to address this. Okay. All right, Adam. I can see from my notes that you are interesting. Wow. 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 Please, guys, have breakfast on the day of the exam. And please have coffee. And make sure after you have the coffee, you have a washroom, quick washroom run. Okay. Otherwise, you'll be saying what I just said. All right. I can see from my notes, Adam, that you are wanting to get a procedure done. Is that right, Adam? Yes, doctor. Could you tell me what you know about the procedure? Doctor, it's I know that you blah, 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 it's a type of contraception, blah, blah, blah. Adam, do you know that it's a permanent method of the contraception? Yes, actually, I'm unsure about it. All right. Okay, Adam, can I have a chat with you before we get to the me explaining you everything? Yes, doctor. All right. Could you tell me, very important question, guys, listen to me. Have you been pressured into making this decision? Very important question. Adam, did anybody influence you? Did anybody tell you about this procedure that you want to get it done? No, doctor, it's completely my decision. Okay. I am going to ask you some sensitive questions related to your sexual history. If you get uncomfortable, you can ask me to stop. Okay. So, currently, do you have a partner? Yes, doctor. All right. Is it male or female? It's female. All right. Are you sexually active with her? Yes, doctor. All right. Are you practicing safe sex? No, doctor. So he probably doesn't even know about condoms. Okay. And doctor, you know what he'll say? He'll say, doctor, actually, my partner, she takes pills, uh, oral contraceptive pills, but she always forgets to take them. That's why I'm so worried. I decided I should get my procedure done because she forgets to take the pills. Okay. All right. So sexual history done. Coming to the partner. Have you discussed this with your partner, this decision of yours? No, doctor. Now listen very carefully. There is no legal obligation to discuss with your partner. Even if you're married to them, the partner has no right over you. There's no such thing as you don't tell your partner to get your procedure done and you're screwed. That's so wrong. No, you can't. That's not a thing in NHS. Okay. So it's completely the right of the patient. However, we as doctors, we encourage, we recommend that you also talk to partner. Why don't you have a chat with your partner? We always recommend as a friend. Okay. And okay, apart from that, now you have to prove to him that you're a doctor. You're not just assessing his vasectomy and contraception. Do you have any kind of symptoms and how's your general health like? Any discharge from your front passage? Any fever? Okay. And any other headache? Any tummy pain? No, doctor. All right. Any lumps and bumps on the body? No, doctor. So make sure you also do a doctory part of it. Okay. That's it. So major things you need to do in the vasectomy case is, what is the question I told you guys to ask? Pressure. Has anybody pressured you? Second question, discussed with your partner. Okay, these are very important questions. All right. Thank you so much for talking to me, Mr. Adam. Let me explain to you. A vasectomy, as you rightly mentioned, is a procedure where we tie up your tube so that you are unable to ejaculate, which will prevent pregnancy. It is definitely a means of contraception, but I want you to know, Adam, it's a permanent method of contraception. What we recommend, Adam, is you also have a look at the other reversible methods, more temporary methods. I can completely understand that your wife is forgetting to take her pills, but there are other ways that involve contraception where you don't need to remember to take pills. There are other means of contraception. How about we arrange a meeting for you? You can bring in your partner and we can discuss all other modes of contraception, and then you can make up your mind. How does that sound? I can think about it. But doctor, see, I can reverse it, right? Like if I get it done and I change my mind, or you at the moment, Adam, even if he doesn't say that, suppose he didn't say that, you have to also tell him at the moment, Adam, you are quite young and we wouldn't recommend a permanent method. That's because maybe in the future, what if you might change your mind? And then reversing the vasectomy is a little difficult. Now you have to tell him the NHS cost rule. It's a little difficult. And I want you to know the reversal of vasectomy is not covered by NHS. That's a procedure you do privately. You know what I'm saying? Who's going to go through the NHS cost rule? Doctor, but I can have the procedure reversed. Doctor, I can have the procedure reversed. What did I just say? I forgot. Doctor, I can have this procedure reversed. Go ahead and answer, guys. Shoot. Let's go through it. All right. Hello, I'm blah, blah, blah. I can see from my notes that you are here to talk about vasectomy. Well, I'm here to answer all your questions. But first, could I ask you a few questions to get a better understanding of your health? Yes, doctor. What do you know about vasectomy? Doctor, it's a method of contraception. Why do you wish to do it? Doctor, my girlfriend forgets to take her pills. All right. Walk me through your sexual history. Do you have a partner? Have you come? Please don't. My girlfriend forgets to take her pills. Don't ask, do you have a partner? How stupid is that? Don't say that. All right. So could you tell me, have you completed your family? No, doctor. Did you recently? This is very stupid. Did you have any hiccups? How stupid is that? Don't ask that question. Are you pressured into doing this decision? Okay. And have you discussed it with your girlfriend? Okay. And no need to ask this question. Okay. Now you quickly go through a systemic review. All right. Long-term medical conditions, any surgery you've done in there, that's about it. So you don't really do any fitness because you have to deny his request. You're not exactly directly denying. All you're doing is you're asking him to reconsider once. Just once reconsider it. Talk to your girlfriend, have a conversation with us about different methods of contraception. Maybe he's uneducated about these things, right? We have to make sure he knows about it first. Once that's done, then if he decides to have it, then it's okay. You can proceed with it. I would like to inform you that a vasectomy is a permanent form of contraception. It's an irreversible procedure. And I'm sorry to tell you that you mentioned you're not kids, you are still 28. This kind of contraception we wouldn't recommend for you. I understand that it's to proceed with it, but from a professional point of view, I would advise you reconsider, okay? Because since the reason you wish to proceed is because your girlfriend forgets to take OC pills, there are some what if scenarios you should wrong. Like, what if I have to wish to start? This is too much, too extra. Make up your own words. As your way, it is very hard to reverse this surgery. NHS does not cover the reversal. Okay, there is no legal obligation to talk to your wife, but it is highly recommended that you have a chat with her. Okay, how about I book a meeting for you and your girlfriend, offer to book girlfriend in and also him for a long-term contraceptive counseling. However, if the patient persists, you can decide as a GP, you are allowed to decide that you want to proceed. However, involve senior. I will also offer you a leaflet about contraception and kindly I advise that you wear condoms. Okay. Now let's move to scopes. That's the final part of surgery and then we'll be done. Why is the screen shared? Sorry. So guys, well done for coming this far. A last bout of patience and we're going to be done. We're going to be discussing two procedures. One is endoscopy and other is colonoscopy. Okay. I told you guys that in the beginning of the course, there's people are active. They're like, I'm going to do this. But by the end, everybody gets tired. But the ones that don't get tired, they are the ones worth praising. Now coming to endoscopy. Now, guys, I want you to memorize with me. I'm so sorry. So there are some medication rules I want you guys to learn in surgeries. Okay, medication rules. First is if she's taking COCP, if someone's taking contraceptives, you have to tell them to stop a month before the surgery because contraceptives can cause clots. Okay, so you're taking contraceptive. Okay, then stop the contraceptive a month before the procedure. Then, if she's taking metformin, just say, okay, I want you to take the metformin the night and the day before the surgery. After that, you don't take metformin. For the blood thinner rule, it's if she's taking warfarin, then tell her 5 days before the procedure, I advise that you stop taking the warfarin and we will give you before the procedure some subcutaneous or inject your heparin through your skin. Subcutaneous heparin. Okay, so you don't need to take warfarin. So if he's on warfarin, you say, okay, before the procedure, you will fast for 6 hours. And this time you will tell him about the medication rule. So when do you say the medication rule? You always say the medication rule when you're talking about the before of the surgery or before the procedure. So you say, okay, before the procedure, I have some instructions for you. One of the things is that I want you to stop taking the medication you're taking warfarin 5 days before. Okay, keep that in mind. And don't worry about the blood thinning part. We will give you another medicine called heparin to replace it. Okay. And apart from that, I want you to, we will, on the day of the procedure, you will fast for 6 hours and then you go during and then you go after. So that's how you organize your medication rule. For insulin, if someone's on insulin, you ask them, do not take insulin on the day of your procedure. We will be monitoring your glucose. We will be giving you insulin accordingly. Insulin and glucose, potassium, insulin infusion. Glucose, potassium infusion. So there's an infusion we start when people are taking insulin and during surgery, obviously they can't take it. So we give them an infusion, monitoring their glucose, giving glucose for potassium and what is I? Infusion. Okay, let's go to the scopes. Always ask, have you previously been through scope? Have you previously had this procedure done? And always ask their concerns. Okay, whenever scope will come, same thing. Patient has presented to you. Most likely in endoscopy, colonoscopy, your result will be in front of you. And the result says that she has celiac disease. We want to confirm her celiac disease, so we need to do endoscopy. Or the result will say the patient has come to you because she has bleeding and sigmoidoscopy was done before and sigmoidoscopy showed polyps, which is now we need to do colonoscopy. We need to go inside her colon because sigmoid, we just went to sigmoid last time. Now we need to go all the way into colon just to make sure there are not more polyps inside her colon. Let's talk about endoscopy. Let me show you the scenario. Scenario. This is like a breather for you guys. It's a breather while I look for the scenario. Okay. Now listen, I want you guys to memorize with me. Endoscopy and colonoscopy have literally the same rules. You have to remember the before, during, and after. Before is the 6x6 rule. Before we're going to go through the endoscopy, now listen very carefully. When someone has a positive TTG, Adam Smith, 30-year-old gentleman, referred by the GP, diagnosed with celiac disease after a positive TTG. She's been planned, I don't know why Adam became a girl, for endoscopy. Talk to him and tell him everything. So I want you guys to know, why are we doing an, would anybody be able to tell me why are you doing an endoscopy when celiac disease is confirmed? Why are you doing the endoscopy?
Confirmatory test is endoscopic biopsy, right? Blood test cannot confirm a celiac disease.
Brilliant, brilliant. If you can see my camera, I'm clapping for you. Exactly. So positive TTG is not a confirm. It's like saying she has CA125 positive, but you can't confirm cancer unless you have a biopsy. Okay, you can never, the definitive diagnosis to establish the diagnosis of cancer is biopsy. Same for celiac disease, same for inflammatory bowel disease, same for colon cancer. Cancers and celiac disease cannot be confirmed. You cannot say for sure she has celiac disease until you have a sample biopsy. That's why we want to do endoscopy. So Arshi, could you tell me, should we tell her to stop eating a gluten diet before her procedure?
No, because otherwise we won't be able to detect the changes in her.
Exactly. So in these cases, always do the 6x6 rule. All right, you're undergoing an endoscopy. So I recommend that I don't want you to do any special changes in your diet. Eat as you do normally. And for 6 weeks, you're going to be eating as you normally do. Do not cut down gluten from your diet. Okay. And before the procedure, 6 hours, you will fast. These are the important rules, 6x6 rule. So 6 weeks, you have to continue to eat gluten. And then what if she got diagnosed with celiac disease and she stopped eating gluten? So you have to recommend, now I want you to eat gluten for at least 6 weeks, and then we'll do the procedure. Fasting, once again, just like surgeries, you do 6-hour fasting. During, explain. We will pass a camera through your mouth into your tummy all the way to your gut. And once it's there, we will take a sample and we will send it to the lab. That's it. So please don't explain like 20 million things. Like, don't like make it difficult. Keep it easy. Like easy way of explaining. Okay. We will put a numbing agent for you. Doctor, how long will it take? Not more than 30 minutes. All right. And doctor, what afterwards, will there be any, or if even if she doesn't ask, just say sometimes after it, you might experience some nausea, some tummy cramps, some vomiting, but that's rare. So the most important thing about scopes is just remembering the before, the during, and the after. Now, if we do this case, you're an FI2 at 30-year-old, referred by the GP, diagnosed with celiac disease. Hello, I'm Dr. One of the junior doctors in the outpatient medical. Are you Adam? Yes, doctor. What's your age? Okay. What would you like me to address you? Adam. Okay. I can see from my notes you've been diagnosed with celiac disease. Is that right? Yes, doctor. All right. And I also can see your plan for a procedure. Is that right? Yes, doctor. Okay. Do you know what's going on? What have you been told so far? Doctor, I know that celiac disease is this is. I'm not sure about endoscopy. I want you to explain it to me. All right. Thank you so much. So, guys, what are the important red flags that you need to cover in this case? Any guesses? What are the red flags for celiac disease?
Blood in stool.
How does that kill him? Red flags are what can kill you with that disease. What can kill you with celiac disease?
Cancer, so fever, weight loss, lumps, bumps.
Okay, very good. So it's a long-term complication of celiac disease to develop a lymphoma. Long-term complication. That's why you're going to do the flaws. Well done. But one more acute thing, not a long-term thing, a short-term thing. What's one thing we're worried about with people who have celiac disease? So celiac disease causes diarrhea, a lot of diarrhea. What else does celiac disease cause? Things aren't being absorbed into the intestine because the intestine is super inflamed. So
Nutrition.
intestine, yeah, very good. Nutritional issues, nutritional deficiencies can kill you. So what are the questions, Arshi, that you'll ask this patient? Main questions.
Any numbness anywhere in the body?
Very good. Vitamin B12 deficiency. What else?
Any problems with your vision?
Good.
Yeah.
Anemia.
Yeah, any heart racing?
Very
Fatigue?
good. Very good. Okay. So celiac disease red flag include the long-term lymphoma can happen in these people, and deficiency including vitamin D deficiency, calcium deficiency, anemia, vitamin B12. These are the things you can actually ask with symptoms. Up to you. How many symptoms you want to ask? Few. Have you experienced any? Okay. So same structure. Complaint. All right. Why did you get tested in the first place? Doctor, I had diarrhea. Okay. How long was it going on? 6 months. Oh, that must have impacted your day-to-day life. That sounds like a long time. Yes, doctor. All right. And anything else with this? For instance, any heart racing? Yes, doctor. How about any tiredness? Yes, doctor. How about any numbness in your legs? No, doctor. How about any weight loss, lumps and bumps? No, doctor. How about bone pains? Yes, doctor. All right. Most important second question in celiac disease is family history. Anybody in your family with the same condition? Yes, doctor, my sister has celiac disease. Now you know 100% is most likely having celiac disease. All right. Apart from that, you can ask in about diet. How's your diet? Could you walk me through your diet? Yes, doctor, this, that. Okay, good for you. Any idea you have? Okay, any concern? Blah, blah, blah. Now you move to the management part. All right. Thank you so much for talking to me. Let me explain to you what is celiac disease. Okay, Arshi, would you like to explain in your own, anybody would like to explain in their own words, in simple words, what is celiac disease? That's where the tricky part comes in. You should have your definitions ready.
So, celiac disease, it is an autoimmune condition, which means your body is not able to differentiate between its own cells and the foreign cells, as a result of which it is mistakenly attacking its own self, which in your case is manifesting as some irritation of your gut whenever you consume any food which has gluten in it. Are you following me? The reason why you're having the diarrhea you've been experiencing.
Very good, brilliant. So that was like Arshi was reading it out of somewhere. It's like Arshi wrote this down and read it, although we all know it was her brain working that good. So basically, celiac disease is a type of condition that where you are allergic to gluten, and whenever gluten comes, your body starts attacking its own self. That's why. So it's up to you how you want to define it. I leave it to you. So the reason I told you guys the definitions, you can say it in many different ways. Okay, just make sure you say the word gluten. All right. Now, what we need to do is your TTG have come back positive, but we still need to confirm it. That's why we're going for this camera test. Okay. Do you have any particular questions you want me to address? Yes, doctor, tell me what is it? What's going to happen? Okay. First, I want you to start eating a gluten-full diet. Don't exclude gluten for at least 6 weeks. And then we will invite you to have the test. You will fast 6 hours before the procedure. Am I making sense? Yes, doctor. Okay, now what will happen during the procedure? We will put a numbing agent on the camera, which will be inserted through your mouth, will go all the way to your tummy. And once it's in your tummy, you will hardly feel anything. We will take a tiny tissue sample. We will send it to the lab. Doctor, how long will it take? 30 minutes, not more. All right. After it, you might experience some nausea, some vomiting, but this is very rare. Are you following me? Yes, doctor. Okay, so this is what an endoscopy looks like. I just want you to make sure then after it, I will also refer you to a dietitian so that after this endoscopy, you can be put on a gluten-free diet. At any time you have this, come to the hospital immediately. That's it. That's how you do this scenario. Now, colonoscopy person will come. What is the protocol for colonoscopy? For these people, you don't do like fasting. Fasting is not the thing. You say that, okay, you are, what do you call it? You are scheduled for a colonoscopy. So what we're going to do is that we're going to send you a special diet that you need to follow for some days. And a day before the procedure, we're going to give you some laxatives. These medication will help empty your bowel. Once that is done, your procedure will take place. Okay? There is no 6x6 rule here. Sorry about that. That was only for the endo. Now coming to during, same thing, just through the back passage, not through the mouth. Okay, and then in the procedure, we will take a tube. We will put some numbing agent on it, and it will be inserted through your back passage into your bowel, and we'll take a tissue sample. It will be sent to the lab. That's how simple it is. How long will it last? Maximum 30 minutes. Good for you. You will experience, you might experience some discomfort, some bleeding, some fever after the procedure. But I want you to know that this is completely okay. And at any time it gets too much, come to the hospital immediately. Now, the patient might be, in this case, usually the patient is angry. She's like, doctor, you just did my sigmoidoscopy. It was so uncomfortable. Now you're saying you want to do it again. Why didn't you do it in the first place? Why didn't you do the colonoscopy in the first place? Okay, let me just orient you a little bit. The scenario will be she had sigmoidoscopy done, showed polyps, now need to do colonoscopy. Patient will be like, but doctor, why are you doing it again? I was already so uncomfortable before. Oh, I'm very sorry, but I want you to know, see, sigmoidoscopy is less invasive. We always begin with a less invasive procedure first. And if it comes out normal, that's good. However, I'm very sorry, but like in your case, it seems like there are some polyp, means some growth in your intestine. We have to make sure this growth is not anywhere else inside your colon also, which is also a deeper part of your bowel. Are you following me? Yes, doctor. I want you to know that this time I will write a letter specially to make sure the procedure is made as comfortable as possible. Most likely, I will also write down to give you sedation during the procedure and put a good local anesthetic on the tube. This will assure that you have a more comfortable procedure. I'm sorry you had to go through so much discomfort. So this is all you need to say. These are the cases for scopes. With that, we have come to the end of our lecture, right? I hope. Well done. Well done, guys, for coming to the end of my part of the course. Okay. So, guys, take an hour or 1.5 hour break. And then that class that was missed on 6th June is going to be recovered so that we're able to finish the course this week. Tomorrow will be the last day of the full course. So well done for coming this far, guys. Well done. And let's go through a brainstorm quiz. Okay. Now, who's going to tell me? You guys can even write in the chat your answers. Okay. The first question is, let's see if this course actually gave you any benefit. Okay. Guys, patient presents to you with inability to remain seated, inability to concentrate. What is the advice you're going to give him according to the mnemonic I got? First, diagnose this patient. He cannot remain seated. Yes. Well done, Arshi. Well done. What was the advice mnemonic that I gave you guys?
Was plan your day out.
Yes. So it was row.
Yeah.
Yeah, well done. Okay. So it's what was the R? Regular short breaks. O
Yeah.
was for do one thing at a time. W was for work in a quiet area. And W was for write down your tasks.
Write down all the tasks for the day.
Well done, Arshi. Okay. Patient has presented to you saying that I have Parkinson's disease, doctor, and I'm having trouble getting to my kitchen, getting to my bathroom because I can't walk that well. Who do you want to involve in the NHS? Which service would you like to use to help her?
Occupational health.
Well done. Okay. Another patient has presented to you, doctor, I have a problem. Doctor, I have what do you call it? Ankylosing spondylitis, and I sit on the desk all day at my work. Who do you want to involve? Which service?
Occupational therapist.
Well done. So you need to know the difference between the two. Proud of you, Arshi. Proud of you. Okay. Doctor, I don't want to come to the hospital to be treated, but I'm a huge red flag. I'm a walking red flag, but I'm not coming to the hospital to get treated.
Crisis resolution home treatment team.
Well done. So this, you have to have everything on your fingertips. Okay, doctor. The problem is, let me tell you what the problem is, doctor. Why didn't you give me antibiotics last time? I get that it was a minor procedure. And I also understand that, I don't have long-term medical condition. That's why. But you are giving me antibiotics now. Why didn't you just give me them before? What are you going to use? Power move.
In your case, giving antibiotics would have done more harm than good to you because of
Well
antibiotics.
done. She is reading my brain word to word. Okay. So tell me, let me see. Okay. Patient has presented to you with tummy pain, left lower quadrant, plus blood and stool. What is the most likely diagnosis? Did I mention sudden?
The age of the patient.
Sorry, what?
What is the age of the patient? Is it like an old patient?
No, it's just a 45-year-old, middle-aged. Sudden tummy pain, blood and stool.
Is the patient getting
Yeah.
better and defecating?
No,
Is it cancer, colon cancer? But it's sudden.
it's sudden. So that's the hint. So if you maybe you didn't take the class for like Azram taught you guys taught you guys what do you call it, the GIT, right? So that's when you need to know that whenever it's a sudden pain in the left lower, guys, this disease is not our country's disease. That's why we don't know much about it. Okay, so when it's left lower quadrant with the blood and stool, it's diverticulitis. Don't forget. And the only solution to this is refer to the emergency immediately.
Yes, I was thinking diverticulitis. The reason why I asked if it's getting better, like if the pain is getting better on passing stool,
Well done.
because he told us that in diverticulitis, the pain it gets better on passing stool, but in colon cancer, it does.
Really? Okay. Just remember the biggest difference is sudden tummy pain on the left lower quadrant.
Okay.
Now tell me. Patient has presented to you with recent childbirth, is now complaining of low mood, baby seems creepy looking. What is the best management plan for this patient?
Urgent psychiatric.
Well done. Urgent referral. Seems like a postpartum depression, girl. Okay. Patient has presented to you with, I love the tummy pain scenario. Tummy pain, right hypochondrium plus tummy pain on the right hypochondrium, no fever, nothing. What's most likely? She's a 30-year-old.
Cholecystitis.
There is no fever, my love. There's three conditions that are quite similar to each other. The first one is cholelithiasis, which means there's only stones in the in the gallbladder. Then, if one of the stones gets obstructed in the neck of the gallbladder, you have the second condition called the biliary colic. This is biliary colic. Okay. Then comes if the biliary colic causes, if you don't treat it and it gets stuck, this starts getting inflamed. This is known as cholecystitis. So where this had 0 symptoms, this had only pain symptom, this had pain plus fever symptom. And finally, if this starts inflaming the bile duct as well, that is the next step of the whole pathway. This is known as this part. If it gets inflamed, it's cholangitis. And the only thing there is added is the jaundice in this case. So all of these cases come in sequence. No symptoms, pain, pain and fever, pain and fever and jaundice. You get what I'm saying? So that's the order. When I taught GIT, I taught this. So remember, so this girl, look at it, Arshi now. What do you think what's going on with her? Just tummy pain. No, just pain, one symptom. Sudden onset of tummy pain. This is known as biliary colic.
Colic, yes.
Biliary colic comes suddenly. And you'll see she has stones in her gallbladder. So yeah, I got my ultrasound done, it showed stone in the gallbladder. And most likely biliary colic is caused because sometimes that stone gets stuck in the neck and then the gallbladder goes crazy. So it goes like, pain. The moment it contracts, it causes pain, spastic pain, colic pain. And then the pain goes away because this probably the stone was like thrown away. Okay.
Okay, thank you.
That makes sense, right? That's what biliary colic is. So the only treatment for biliary colic, honey, here's a painkiller. Go get an ultrasound if she hasn't done it before. Here's a painkiller, supportive management. Okay, next question. Patient has presented to you with fever, recurrent discharges in the past. Recurrent discharges from front passage. What's the most likely disease?
PID?
Well done. What is the management?
Admission.
Well done. This is how on your fingertips you should have everything. That's PLAB 2 for you. Patient has presented to you with irritability. He's not sitting, he's agitated. And then, he's complaining of this lump that he's obsessed about. Last week he came because his hands were swollen. He felt like something's going on with his hands. Before that, he presented with headache. He thought he's going to die from the headache. What's most likely the disease?
Somatoform.
Well done. How do you differentiate somatoform from health anxiety?
Health anxiety is when a patient is worried about one particular disease. And in somatoform, he thinks he has everything in the world, all the diseases in the book.
Well done. Brilliant. Patient has presented to you with, doctor, actually, I want a sick note because my workplace is like, I don't have car to drive to my workplace. Give me a sick note. What service will I use? The first letter is right there.
Citizen Advisory Bureau.
Well done. CAB. Okay. Patient has presented to you with mild depression. You've diagnosed him as mild depression. What's the treatment? What is the management plan?
CBT only.
Well done. Okay. In which medicine, in which meds do you need to involve your senior to give?
Antidepressants.
Well done. Which medicines can only be given by specialist?
I was gonna say magnesium sulfate
Very,
and
oh my God, that's amazing. That's amazing. Like you can even add senior situation over here, but only a specialist can give it. Let's see. Good question. Antipsychotics for sure. Anti-thyroid medications. Remember, you can never give these in the GP. Okay, so these are like just basic safety netting rules that I taught you guys. That's what you need to remember. For anorexia, do the eating disorder unit. For bulimia, do the self-help programs. Let's see. For heroin abuse, do the addiction rehabilitation treatment center. For rape, sexual assault referral center. For insomnia, do the sleep questions and assess why the insomnia is caused. Obstructive sleep apnea, most important, refer to the sleep clinic. So this is how everything should be brainstormed in your mind. Brainstorm, that's the thing. All right. So guys, congratulations for coming to the end of the show. Wow. And we've stole the show. Okay, well done, guys. Well done. Arshi, especially, huge shout out to you for being a regular customer. You have proved it that the Pygmalion effect is real. Go try to see it on YouTube. What is the Pygmalion effect? Arshi, we have applied to you and you've done it brilliantly. Well done. And everybody who's watching this recording, yeah, Arshi is the coolest. Okay, you watch the recording. See you in the next live. Okay, that's just too much. And that's about it. Okay, so now take a break and have a good time, guys. Good luck for your exam. Thank you all for listening to me. And thank you so much for being such good students. Okay, thank you so much for performing so well. Literally, this entire course, everyone performed beautifully. Honestly, the best participation, the best right answers. Otherwise, people did participate, but they always gave the wrong. But this time, geniuses, and Arshi was like leading the world. Well done, Arshi. Okay, guys, thank you so much for watching. Well, it's not a video. So in 1 hour, take that break. And then we'll complete the course. And then good luck for your exam. All of you are going to nail it. If you go about my way, rewatch these videos, revise these recordings once again. And honey, there is no way you will fail in the first attempt if you follow the rules that I taught you. That's it. Say the name of the person. Let me go through my rules. Say the name of the person while talking to them. Talk in one breath. Don't forget red flag and safety netting. Eat breakfast before your exam. Don't study last day before your exam. Always keep the history short in ethical stations. Always involve seniors when giving antidepressants. Always know the difference between urgent referral, immediate referral, and discharge. It's not necessary to do leaflets and follow up as much as it is important to do safety netting. Okay, these are rules that I taught you over my course. Keep these in your mind when you go to your exam. If your exam is tomorrow and you're watching this, honey, good luck. Good luck. Good luck.
thank you so much, Dr. Hasna.
Thank you, Arshi, for being such a good participant of the course. Well done. Proud of you.